Hi everyone, I'm Vicky Bartlett. I'm a fourth year medical student at Yale, and I'm representing the ACP's Wellness Wave on the East Coast. I'm so excited today to be interviewing Dr. Susan Kashaf. Dr. Kashaf, I know you best as a primary care physician and attending at the West Haven VA, but I also know that as a clinician educator, you're involved in many other roles at the medical school. So could you tell our viewers a bit about yourself and what you do?
Sure. It's really nice speaking with you, Vicky. So I am a general internist, and I did my residency in internal medicine at Yale, and surprisingly decided to stay on in general medicine at the VA hospital. I actually went into internal medicine thinking I was going to be taking care of women, and I take care of almost all men. So that was the biggest surprise. And I also never thought that I'd necessarily be working at a VA hospital, but I found my niche within that and love that very much. So that's my clinical work, where I attend on the inpatient service, where we had the pleasure of working together. And I also work in the outpatient clinics as a general internist and supervise resident clinics in that context. And in my role as a clinician educator, I do a lot of clinical teaching and also some didactic teaching and faculty development on feedback, and have done coaching in the past, and presently spend most of my non-clinical time in my role as an academic advisor, which I love as well, and also do mentoring with on the GME side with medical residents.
I guess, can you tell us a little bit more about how you chose your career path, how you figured out like what was right for you?
Decided to go to Yale and really liked it very much as far as the community. And that was part of what determined my path as well. At the time when I did residency, it was very much, which fellowship will you do? Not will you do a fellowship? And I had a lovely meeting with my program director who asked that question. And again, my kind of core values were, I'm more of a generalist at heart. And I had been doing my clinic at the VA. And even though at that time, it was not as well organized as it is now, and that you would just go to clinic, it would be post call and you'd have like 8 patients and it was chaos. I found that I really enjoyed those encounters with those patients. And especially as I got to know them, I found that I just really liked being in clinic, even when I, wasn't happy to leave my inpatient rotation to go to clinic. When it came time to look for jobs, I knew that I wanted to teach. I knew that I wanted to still do inpatient in addition to outpatient. And this was a great job that allowed me to do all of those things.
What advice do you have for medical students or residents as they're trying to figure out their career paths?
What I really think is important at every step is to reflect on what is important to you as a person. Like, what are your core values and what are the things that you need to make you happy? And that's different for different people. It might be like, I don't want to throw any family members under the bus, but I have some family members where for them, like, it's ranking. It's like, they don't care about anything else as far as, culture or anything. It's like, this ranking really means so much to them. Know that about yourself. If that's what you care about, then fine. Great, go with it. But, but it might be, it might be culture. It might be like really kind of knowing what it is for you that helps you be successful, and then going with that and trying to assess that. So for me, a collaborative culture is really important.
And then our last wellness question is, what things do you feel are helpful or have been helpful for you in managing stress?
So friendships I have that really kind of overlap work and life. And I have a good friend who was my chief resident, who took this job before I did, and who I've been like growing with for the past 20 some odd years, who is a mentor and a colleague. And every day at 5:45, we meet and we take a walk. So this was the view from from where we start our walk, which is at a parking lot at a hotel, which is about 5 minutes from me and 5 minutes from her. And we walk in our work clothes, and then we talk the whole time. And it's a, you know, flight of ideas, going through everything that's happening. And sometimes it's literally running a case by her, or her running a case by me, or talking about what's going on with my kids, and having that support. I think whatever way you build it. So for me, that's a big part of it.
Yeah, I imagine, especially during like all the uncertainty of the pandemic, like having at least one thing that's constant and you know it's going to happen
Absolutely.
tomorrow.
Absolutely. I think you're right. I think it's not just actually what it gives me, but the consistency is really important too. Yeah.
Thank you so much, Dr. Kashaf. I've really loved
Pleasure.
talking with you and learning more about your path and learning from your experiences.
Well, I look forward to watching your path, Vicki.
Oh, thank you.
All right. Take care.
Okay.